It's Dr. Latowski here. Can you guys hear me? I always have to check this because sometimes we have technical difficulties. There we go. Happy Valentine's Day. Oh gosh. Thank you all for tuning in today. I'm so happy to see you. Happy Valentine's Day. Thank you for taking a little bit of time today to spend with me. Let's do this. So let me get into the slideshow. First of all, I want to tell you, doing lips is one of my favorite things because they're just so fun. And I don't care who you are. I think that everyone can use just even a teeny tiny little bit of plumping in their lip. So I often joke with my staff about having lip envy when I'm doing lips. And I probably have said the same to you guys if I've ever done your lips. But doing lips just makes me want to have my own lips done, do more of them. It's kind of like a fun cycle because the more I do them, the more I want to do. They're just so fun. And I think everyone listening to this deserves to have their lips done as a little Valentine's Day treat. So here are the things that we offer in the practice. Today we're talking about fillers. And we are talking specifically about lip filler and how we can rejuvenate the face with lip filler. It's very surprising to me how much we can rejuvenate simply by inflating the lips a little bit. And I'm not talking about duck lips. I'm not talking about anything dramatic that one might see on social media. I'm talking about small little tweaks that can actually make a huge difference. So as time goes on, our lips get smaller and they get thinner, and we start getting lines. We get lines around our lips. We get lines in what's called the marionettes, and we can reverse these signs of aging. And since the lips are front and center, it's one of the most useful things we can do to rejuvenate the face and make the face look super rested and more youthful and refreshed. So what causes aging around the mouth? Our genetics is huge. It's probably number one, but also sun, smoking for sure, age-related volume loss. So you can see the results of that on the right on this picture here. And we can absolutely help with all this. In fact, I was talking to my patient last week about a friend of hers, and she said, oh, her friend is a smoker and she really needs help around the mouth. And I said, I could probably do things that would make her feel so confident about herself, and she would look so refreshed. It would change her life. It would change her life to rejuvenate this area. And that's totally doable. Lips are different based on age, and I treat lips differently based on age. Now, I want you guys listening to realize that younger patients are more likely to be my staff members and willing to put their pictures on social media. Younger patients are more likely to show their before and afters on social media and for things like this. Some of my patients who are not into social media don't really like that. So a lot of patients are like, you show a lot of young patients, but just so you know, I treat lips of all ages, and I'm going to show you examples of all ages today in this webinar. But I will tell you, at any age, we can make your lips look better and more refreshed. So anyway, younger patients tend to want more volume in their lips, or their lips might be asymmetrical. So we're correcting some natural asymmetry. Older patients just want their lips to feel, I usually say starting out, this is going to make your lips look like they did 3 to 5 years ago, but then we can build on that. And if we do all the way around the mouth, not only lips, but like lip lines, marionettes, we're talking about 10 years off or even 20 years off. And so I get really excited about this because this is something, again, that it can be life changing. Okay, so here's a before and after. And I want you to look at her marionettes. So this area here, and then I want you to look at her lips. Now, this is a nice subtle change, but this is what we want. We want we want our results to look totally natural. This patient obviously didn't want to look like her lips were done. She just wanted them to look like they did 3 to 5 years ago or even more. And you can see from the beautiful smoothing of her lower face that we achieved that. And also, her lips are so beautiful. And I will tell you, when you have this done, you will go buy more lipstick because it's so fun to put lipstick on after you do this. So here's a younger patient, and she wanted her lips to look more hydrated and she wanted a little bit more volume. Now, this might not be for all of you watching, but you can see she still has a very natural result, and she was thrilled with these results. They look more hydrated and they have more volume to them. They were exactly what she wanted. So, what are lip fillers? What are we putting in there anyway? Fillers are a gel like substance, and we inject this gel underneath the skin, and it adds volume and definition. So sometimes as we age, everything gets kind of saggy, as we know, and the lip loses its structure. So then it loses its contour. When you put lipstick on, it starts to bleed. So we can restore the structure, definition to your lips, and by using lip filler, and we can also add volume. And then we have many options. We have lots of tools in the toolbox to help with your lips. So the tools we tend to use are made up of hyaluronic acid. And so that is something that we inject directly into the lips. It increases size, it increases volume. It's found naturally in our own skin. So it's very, very safe. It's also hydrating because hyaluronic acid attracts water. That's why it's in a lot of moisturizers. You've probably seen it in some moisturizers. It attracts water and can moisturize and keep the lips looking hydrated. So it's really great to use in the lips. If you've seen some celebrities out there with not so natural looking lips, sometimes that's actually not hyaluronic acid filler. Sometimes that's actually something like silicone or more permanent filler, which in my opinion is not a great idea. So again, the results are very long lasting. The lip filler tends to last at least a year, sometimes even longer. And worst case scenario, if someone doesn't like it or if the filler migrates a little bit, it can be dissolved easily by injecting a liquid, which is an enzyme called hyaluronidase. And so here is a cartoon that shows you what the gel looks like on the left. And then on the right, you can see that in the middle, the 1 ml, that's 1 syringe of filler. So 1 ml is actually not that much. And so, of course, one of the main concerns when people come in is being unnatural. So you can see by putting 1 ml properly in the lips, this is not enough product to make your lips look unnatural. So this is a very, very natural looking, and it's just a beautiful, beautiful result. So here's a little bit of anatomy. This is what we're working on during filling of the lips. So the philtrum, you can see that's on the skin part of the lip. That helps to evert the lips. It helps to curve them outward and provide more contour. The Cupid's bow can do the same thing, and we often like to make sure that the Cupid's bow is well defined, but again, in a natural way. The vermilion border, that's something that I can enhance if the lipstick is running. And it also, by enhancing the vermilion border, can also help the lip lines. And then you have the lower vermilion, That's the lower pink part. And then the oral commissures, those are what I typically call the angles of the mouth. So the oral commissures, and they tend to turn down over time. We can easily put them back to neutral with some filler. So we work on it. I'm thinking about all these things when I'm doing lip filler. We work on them all together. So again, even by doing the lips, we can reduce the appearance of fine lines on the skin part of the lip and surrounding the mouth area. We will make the area look happier. We make it look less tired. And again, this is a change that can be dramatic and even life-changing for some people because they feel so much more confident after they have this done. We can add a natural fullness. We can balance your asymmetry, and we can improve texture by making the skin look better hydrated. And then we talked about more structure can hold the lipstick in place better. And I'm warning you, you're going to want to buy lipstick. So here's a patient. We especially picked this photo out for you guys. So I treated her lip line. She had lip lines that bothered her. The corners of her mouth were going down. She had these marionette lines. So not only the oral commissures, but the marionette lines. And I also treated her lips. So in the after picture, you can see she looks completely natural. She looks a lot smoother. She still has lines, so she doesn't artificially look like a 20-year-old. She looks age appropriate, but you can see how much smoother it is. And even though she wasn't supposed to wear makeup on that day, how much she loves her lipstick now. So just beautiful results. And you can see how these results can give you so much confidence in your day-to-day life. So you know that safety is huge to me. I really, really value safety, and doing clinical trials, we have a lot of respect for FDA approval. So Juvederm fillers have been FDA approved since 2006, and then they got FDA approved for the in 2016, but they have been used in the lips since well before that. And then same thing with Restylane. Restylane is actually the first hyaluronic acid filler to be approved by the FDA, and it was FDA approved in 2003. And then their product Restylane Kiss got an FDA indication in 2020. However, again, we were using Restylane in the lips before that. So this is a fairly safe procedure. Every procedure we do, even taking over-the-counter Tylenol, has risks. Getting in our car has risks. So our goal is always to minimize, make this as safe as possible for you. And this is an area that is low risk when we're talking about filler. So there are many, as I mentioned, tools in the toolbox, different brands, different products within the brand. And there are minor differences between these products. When I'm evaluating you in consultation, I am taking these factors about your individual anatomy, your aging process, your environmental exposure, and your wants, your desires. I'm taking that all into consideration and picking out the perfect filler for you. And sometimes patients come in and they say, oh, I actually didn't like Juvederm in my lips. Do we try Restylane or so on? And it's great to have options. And sometimes if you've had your lips done before and you didn't necessarily like them, sometimes there's a different way to do it or a different product to use. And so I'd highly encourage you to reconsider. It's very straightforward. Treatment's very quick, depending on how much we do. It can just take a few minutes, up to an hour if we're doing a more extensive rejuvenation. We make it very comfortable for you. So I used to do a lot of full blocks for doing lips, and I still can do that if someone really wants to, but we don't even have to anymore. There's powdered lidocaine within the fillers. So the lips go numb instantly when I inject the filler. And we have a very effective numbing cream that we apply a certain amount of time before the procedure. We also use a lot of ice, and my assistant uses distraction techniques during the procedure. And most patients have absolutely no problems getting this done. There can be bruising, and we give you tips on preventing bruising. For instance, I recommend a lot of ice before, during, and after the procedure. I recommend arnica starting right after the procedure, and bromelain, which is a supplement, is the active enzyme in pineapple. And bromelain is anti-inflammatory, and that can even be started before the procedure and continued after the procedure. Swelling can last 2 to 7 days depending on the person and the product we use, and I can talk that over with you in our consultation. Potential serious side effects are very, very rare. And of course, we always want to know your medical history. You want to tell us if you have cold sores, autoimmune conditions, etc. We don't do this procedure in pregnant or nursing women or in patients who are very immunocompromised or have very low platelets. If the platelets are a little bit low, I can do the procedure, but we'll talk about the risks of bruising and restrictions. One of the things I take great pride in is that we have a very medically based clinic. So we have your medical history, we take it, we update it periodically. And of course, we always want to know your up to date medical history so we can take that into consideration and give you the safest and best results possible. After filler, I recommend no makeup or exercise for 48 hours. I recommend no flying for 24 hours and no dental work within 2 weeks, no dental cleanings within 2 weeks, and no dental drillings within 2 months. So those are really pretty much my only restrictions after having your lips done. One should be prepared for a little bit of swelling and potentially some bruising. I see that someone in the comments might be asking if I use cannula or needles, and the answer is I use both of them. So we can use cannulas if someone is extremely concerned about bruising and swelling, and the use of cannulas can greatly decrease that. I use needles a lot because, to be honest, a lot of patients find that needles are easier for them to sit through, and the needles are actually a little bit more precise. So, today you'll see me using a needle for part of the injection and a cannula for part of the injection, and I use those both. So consultation is very important to me. I want to do what makes you happy and what looks the most natural and the best. And so it's really important for me that we discuss your goals and create a plan together. We will assess your facial balance to ensure the most natural results for you. And I will help you choose what filler is right for you based on multiple things I've mentioned. We can do the same day of treatment, or you could come in for consultation, consider it, come back at a day that's easier or better for you. And I tend to be very conservative, so less is more. We can always add more. I love that patients feel like they are not overfilled, that they look very natural. And again, we will talk about this during the consultation, but I just want you to know that we have a very, very natural approach to filler, especially lip filler, in our office. Here's some more before and afters. So this is a younger patient. As you can see, she wanted more volume. You can see immediately afterwards, she's puffy, which she actually loved. And then afterwards, she had a more natural and hydrated results. And if you look at the before and after, you can see that her lips are definitely more hydrated looking. So again, different patient before, immediately after, and then after the swelling has gone down. And it looks like the patient had lip gloss on in this photo, but you can see how beautiful and hydrated the lips are afterwards. She was thrilled. And here's another example. before one treatment. Then we did a little bit of touch-up. She wanted a little bit more. We did conservative treatment. And again, that's an option for you. We can always start with less, and we can always add more to get to your desired results. Before, immediately after, and the final results. You look at the final result, it's so beautiful, so natural looking. Again, here's a patient who's a little bit older, so I take this approach a little bit differently. Look at her lip lines, smoothed out. Look at her lip. It's enhanced, but it still looks very natural, very age appropriate. You can imagine how it's easier for her to wear lipstick now. And look at her chin. Look how much smoother it is. But again, we still look age appropriate there. And we could actually keep going from that after picture, but the patient was very satisfied and chose to stop at that point. Here's another photo of a little bit of an older patient. So you can see her lips have been enhanced. It looks very smooth. They look very hydrated. I also enhanced the corners of her mouth, the oral commissures, and also her chin. And you can see in our after picture, the below picture, it looks a lot smoother, but again, still very natural, very age appropriate. If she wanted to continue to get improvement, we could, but this is an example of a result that the patient was thrilled with. We just received this picture yesterday, so we thought we'd throw it in. This is a patient who wanted a lot of volume. We did this over 2 visits because I didn't want to go too big, but she wanted them bigger after her first follow-up. So you can see the very beginning on the top of each photo and the afters below. And she is absolutely thrilled with her results. They're the size she wants, and she's super happy. If some of you tuned into our last webinar, this is our lovely model who's a staff member in our office, and she had beautiful and natural looking results. In the webinar, we did her tear trough, so the eyelid area, the lower eyelid area, and I supported her cheeks, so I lifted her cheeks a little bit, so lifting without making them too big. And then I also put a little bit of filler in her lips on the right. You can see her lips enhanced just a tiny bit, just naturally. And she's very thrilled, and you can see it's a beautiful, natural results. And I see a question, do you provide lip fillers for men? Absolutely. I do this for men. And again, men have their own technique that I use that differs from women, but I do men's lip filler actually more frequently than you would think. So we can get a great result. And then someone's asking, how many syringes does it take for moderate changes? So actually, usually only 1 change for moderate changes like what you're seeing in these before and afters. And then again, this is lovely Sharon again, our model, just some different views that you can see. On the left, we threw in her full face because you can see her beautiful improvement from her tear troughs, the lower eyelid area, the beautiful definition of her cheeks now that they're more supported. And then, of course, the topic today is the lips, and you can see how they're a little bit more defined, contoured, but they look completely natural. Here's another example, before and after. Patient was thrilled. Before and after. A little bit of a younger patient, before and after. And one moment here. And then here's another, oh, there it is. There's another before and after where you can see we did a little bit more of her lip lines, the philtrum to everted her lip and gave her lip more volume. A little bit younger patient, but you can see already the lips were looking dehydrated. Now they look beautiful, hydrated, and she has a little bit more balance, a little bit more volume without looking too overdone. Another example, before and after. Before and after. And again, beautiful result. Patient was thrilled. All right, so here is your raffle prize. So just by attending today, you will be eligible to receive filler. So you could win a complimentary lip filler syringe, of Wrestle and Kiss, and this is great value because it's worth at least $750. And then just a little note about the product that we're promoting today. Wrestle and Kiss is specifically FDA approved for the lips for the results. Okay, so here's your goodie for signing up today. And you guys are getting an extra value because there's actually a little typo here. I thought this was true. The filler is actually $775 for the lips, but Heather's giving it to you for $750. So she's giving you an extra $25 off. So thank you, Heather. And I'll subtract that from your paycheck. No, that's okay. Just kidding. It's coming from my paycheck instead. So, um, and so the promo is you get this filler for 750 instead of 775, and you get a free syringe that goes around your mouth for the lip lines. If you don't have lip lines and you want to use it somewhere else, we will absolutely do that for you. But what we wanted to do with this promo is we wanted to really promote treatment of the whole area. So when we're treating you aesthetically, instead of just thinking of one area, we want to think of the whole area as being rejuvenated. So I wanted to make this treatment as impactful as possible for you. So we want to treat your lips and your lip lines, or we could do your lips, your marionette lines, your lips, and your chin. And I I am going to treat my subject's lips, and if we have time, or if you want to continue to stay in for the demo, I'm also going to treat her chin today. So she's very young. She does not have any lip lines yet. She doesn't have any marionettes. She doesn't have any downturn, but we're going to enhance her chin a little bit to enhance her profile. So some of you might recognize our model today. She is Maya, my medical assistant, one of my medical assistants. So my team is all very excited about this treatment today. And I hope you guys decide to take advantage of this offer because we're really trying to be impactful. And by the way, if you have a loved one, this is a great Valentine's Day gift for your loved one or for yourself. I just think that in this day and age, we all need to think about self-care. And I think this is a great way to do your self-care. All right, so I'm going to pause for a moment here, and we will set up for this treatment. We're going to treat her lips first, and then I'll treat her chin. And hope you decide to stay for that. So give me a moment, and I will just pause and set up. everyone. Welcome back. Thank you so much for staying to watch. This is the lovely and beautiful Maya. You might have known her before. You might have seen her before. She is on my team, and I always tell her that I get lip envy when injecting lips, so maybe she gets it too. So she volunteered to be a model today, and I'm also going to enhance her chin a little bit to soften her chin and to enhance her entire profile. So we're really excited about this. How do you feel being on the other side of this?
It's weird being on this side, but I'm excited. I'm numb and I'm excited.
Okay, perfect. And you've never had filler before?
Never.
Okay, great. And we talked before the webinar, and she was saying, obviously, she's so beautiful. She doesn't have any lip lines, but she wants her lips to look a little bit more hydrated, and she wants the volume to be enhanced a little bit. And because she's very young, we definitely have room to increase the volume while still maintaining her lip shape. We always try to maintain the shape. We always want it to look like your lips and look completely natural. So I'm very excited for this. And the entire team has been looking forward to this. Okay, so we put numbing cream on, and Maya's saying she's extremely numb. And one thing is sometimes patients feel like they can't even talk because they feel so numb. So she was saying that earlier too. All right, my dear. So tip your chin up for me. Thank you so much. Close your eyes. Okay, here we go. A little bit. Amazing. Great job. Beautiful. Gorgeous. And I just want to say, we'll probably do the whole treatment on camera today. So if anyone wants to just hop off because of time restrictions or you've seen enough, that's totally fine. You'll still be entered in the raffle. So I don't want you to feel like you have to watch this entire thing. But just because we're going to have fun, we're probably going to take or video the whole thing today. Unless Maya decides she needs a break. Then we'll stop. Okay, and tip your chin up and relax your chin up. Beautiful. Here we go. Gorgeous Maya. He's so pretty. Amazing. Now you know firsthand what it feels like. So she'll have even more empathy if that's possible for all our patients coming in and getting their lips done. Great. How's it feeling? Is it feeling okay?
Yeah, I feel really numb.
Okay. That's great. Chin up for me. Good. And relax your jaw. Beautiful. Beautiful. As you can see, it's a nice natural look, not too big. More hydrated looking already. Now we'll go to the lower lip. Lower lip is less sensitive. And I got the sensitive area over with. So that's nice. I was just treating my friend the other day in her lips, and I told her, you're going to want to buy lipstick after this, just warning you. She's like, oh no, I have so many lipsticks, and I didn't wear anything during the pandemic, and I'm out of the habit. And I think she's up to like 4 or 5 new lipsticks that she's bought since we did her lips. So I'm telling you firsthand, I know that it's going to be very tempting. You're going to want to go buy new lip gloss and lipstick. So fun. Beautiful. Beautiful. Oh, so pretty. Maya actually came in on her day off today and get this done. So super thankful that she wanted to do this. Gorgeous. Looks great, my dear. Okay, I'm gonna go to the other side. You feel good?
Yep.
All right. Can you guys imagine first time filler and being on camera and doing your lips at the same time? I think she gets the gold star of the day. You're doing great. Thank you. Beautiful. Great job. Just gonna adjust the table a little bit here. Good job, Maya. Doing awesome. Sensitive areas almost done. Starting to feel pretty numb. Yeah. Something about lips is after you get started, they're really pretty numb and you don't really feel much after the first few injections. It's kind of counterintuitive. They're so sensitive to begin with. Gorgeous, gorgeous definition of your lip too there. Oh, I should remember. Good job. Awesome. Here. And going up a little bit. I love having these chairs that move because I get patients in exactly the right angle for me to inject easily. Just makes things easier on the patient and myself. And you're wanting to get a CTA and looking down. Okay, turn a little down there. Okay, good. Now, turn this way. Gorgeous. All right, I will take the ice back. So right now we've done 2/3 of a syringe. So we haven't really used much. I'll probably end up using the entire syringe because I think she'll want it eventually. But I'll probably stop and massage after this. That creates a beautiful contour. Over here and hold the CTA over here. It's right there.
Gorgeous. Okay, a little there. All right, so I'm just going to massage a little bit. I've used 7/10 of a syringe. So if she had some downturned corners of her mouth, I might put a little bit there. If she had some lip lines, I might put a little bit there. For her, I'll probably just check with her off camera, see how we're doing on volume, and then I think she'll probably want the rest of it injected. Check. See already, she's got a gorgeous result. Sure. Open a little bit more over here. All right, one moment. Slightly should be pretty numb here. Here we go. Okay. Mm-hmm. Go. All right. There, that's better. Beautiful. All right. So here are the initial lips. You know what's cool is the lips tend to look pinker after we inject them. And you can see that here for her already. And I think it's because we push the blood vessels a little closer to the surface of the skin, or at least give them more structure. But look at the beautiful color of her lip. It's so pretty. And look how luscious and hydrated they look already. And lips attract, or I'm sorry, hyaluronic acid attracts water over 2 weeks. So over a 2-week period of time, the hydration component, not the volume, but the hydration part, will look even better. So I think they look so good. I'm getting lip envy. Oh gosh. I'm excited to see them. Yeah, I'm excited for you to see them. Okay, so let's do your chin. And we'll have you take it. And then we'll talk about if you want to use the rest of the search. All right. Right here. All right, so doing the chin is one of my favorite things to do. And it's something that people don't really think about. But a pointy chin, and I'm not talking about Maya specifically here, but a pointy chin is not a youthful look. So we want the chin to be soft, contoured, and that goes for women. For men, we want a more angular approach. So there is a difference between men and women. So because I'm treating a female right now, I'm just talking about women. And by doing this, it can really have impactful results, give the lips more structure so that they're more noticeable, and kind of redefine the structure of the face. So here we go, a little pressure. And sometimes, so this is a cannula, you guys, so this is not going to bruise most likely. And there's going to be very little swelling, but you can see it looks kind of scary. But sorry, Sorry, Maya.
It's okay.
It actually isn't scary. What does it feel like, Maya? Does it feel
It
pinchy?
just feels like pressure. Sometimes a little pinchy, but it's tolerable.
Okay. Definitely lid lips were more sensitive, would you
Oh
say?
yeah,
Yeah.
definitely.
Yeah. So with cannulas, sometimes it looks scarier than it actually is. And Maya knows that. She sees me do this all day long every day. Okay, let's take a look. How things are looking. Oh my gosh, that is gorgeous. So you can see this is very subtle if you're just like taking her beauty all in, but you can see how this is blended and it's making her chin look softer, more contoured, more feminine on this right side, whereas on the left side it's more angular, and we just noticed that her chin may be a little bit more pronounced. So I just love this look. I think you're going to absolutely love it.
Exciting.
So funny is we spend so much time at work with the mask on that, I hadn't ever thought about doing this for you until today. So this is kind of fun that we're doing this. All right. And come over here with the light, please. So this little light helps me avoid blood vessels and therefore keep the injections as safe as possible. And with as little bruising as possible. It's not a fail safe, but it definitely helps. Okay. So, yep, perfect. A little bit more. Well, sure. Treatment. You okay, Dad?
Mhm.
Okay. Beautiful. So we're going to send you guys photos, after photos, of Maya's gorgeous face. See what you guys think. Little pressure. Great. Amazing. Okay, last little bit here. Beautiful. Okay. Gorgeous. Okay, can you guys see the beautiful look that is completely natural? And even though she's so young, you wouldn't have looked at her and said she needed anything, and she really didn't. But this is just so pretty and feminine. All right, you want to take a look at the mirror?
Yes.
Okay, she's going to hand you the mirror.
Gosh, looks really good.
You like?
Yes, I love it.
See how this is softer?
Yes.
And then just a little more volume, definitely more hydrated looking, right?
Yes.
And then enhance your filter to just evert the lip a little bit.
It looks so good, and it's still natural too, which I really like.
Thank you. Thank you. Thank you, everyone, for tuning in today. Happy Valentine's Day, and I hope to see you soon.